Thank you so much for all being here this morning. It's quite a pleasure to present to you. As Pascal said, the title of my talk is Simulation Training for Skill Development in a Resource-Poor Setting. And I'd like to start off by thanking my supervisors, both Pascal and Jan Joost, for all of their guidance and input thus far. I come from the United States, as Pascal said, from a small state, Maryland, which is on the East Coast there in Baltimore. And the hospital that I work for is called Johns Hopkins. I'm actually a pediatric intensive care specialist there and did all of my training there as well. So I've been there for about 17 years. But I actually don't work there clinically. I teach there, and I'm responsible for a lot of administrative processes there. And although I do some time in the intensive care unit, my real interest in research is actually in the developing world. And I lived in Southeast Asia for about 4 years and got very interested while living there in skill development in resource-poor settings. So I'd like to start off by just explaining what I mean by the resource-poor setting, which is an environment where physical, human, or educational capacities to provide clinical care for patients is constrained by financial or logistic factors. So this can be in the developing world, but it can also be in rural settings that are far away from definitive care. So this is actually where the focus of my research project has already taken place and will continue to occur. This is the nation of the Philippines in Southeast Asia. And the setting in which I will be developing my research projects are some of the birthing clinics in the very remote rural areas of the Philippines where the primary care providers on the front line of patient care for mothers and children at the time of birth are midwives working in the community. So they have quite a shortage of nurses and physicians there, so midwives really deliver the majority of care. So I developed the problem statement based on this, that it's not really well understood how clinicians in resource-poor settings, particularly this population of midwives, learn resuscitation skills within the very challenging and resource-constrained clinical environments in which they function. So therefore, it's not really known how to adapt educational paradigms for that population. So I'm interested in thinking about instructional design adaptations, specifically using simulation methodology that may be needed to effectively teach resuscitation skills in a very contextualized way for this population. So to be specific about what skill development I'm speaking of in resuscitation, we're looking at teaching the skill of bag valve mask ventilation for newborns, specifically when babies are not breathing at the time of birth, using this device to actually breathe for them in the case of asphyxia, and also the skill of what's called bimanual uterine compression within obstetrics, where the uterus is squeezed manually in order to prevent or slow down bleeding. So performance of these skills, I think it's important to note, is very time dependent. In other words, the outcome of the patient very much depends on rapid and precise implementation of these maneuvers. And they can be complex skills to learn properly. When I speak about simulation, just to give you a visual description of what I mean, these are some of the mannequins that are utilized in this setting to teach and perform these skills. So this is an actual device that's worn by the instructor that can bleed. It has a simulated uterus that can actually mimic postpartum hemorrhage. And then you have an infant that's born through the vaginal canal of this simulator attached to a placenta. And the infant has an umbilical pulsation that can be generated by the instructor, and the mannequin can be bag valve mask ventilated to learn these skills. In terms of the theoretical framework that I will use, I know many people in this room have developed cognitive load theory, so I don't think I need to explain that too much, but that is the framework that I will be utilizing as the background to the research. So as many of you know, the three components of cognitive load are extraneous, intrinsic, and germane cognitive load. So this will be the platform that I utilize in thinking about designing the research. So my first research question is, what simulation-based medical education strategies are currently in use in resource-poor healthcare settings in the field of resuscitation, and what is known about their efficacy? And this will take the form of a systematic review of the literature, and this is actually already underway in progress. Research question 2 is, how do midwives in a resource-poor setting, such as that in the Philippines, learn and practice these critical resuscitation skills for newborns and mothers within their environments? And what do they perceive from an EMIC perspective to be the cognitive challenges in their environments? This will be a mixed method study, but will be primarily qualitative in nature, with semi-structured interviews of the midwives, but also some direct observations and use of the PASS scale to measure cognitive load and mental effort that they perceive to be existing in their environments. The third research question is, what implications do the environmental resource limitations and intrinsic cognitive load of the practice environment have for the contextualization of the instructional design of a simulation program specific for this setting? And this will be largely design-based research that will utilize the 4C ID model to develop a program specifically integrating maternal and neonatal resuscitation designed for this population of learners. And then finally, research question 4 will be really a form of program evaluation for the aforementioned curriculum. And this question is, to what extent is skill performance of critical resuscitation maneuvers improved by implementing a contextually appropriate instructional design based on cognitive load theory? And this is really looking at educational outcomes of the program, both knowledge outcomes in the form of multiple choice examination, assessment, but also skill development, looking pre and post after implementation of the curriculum in terms of improvement. It will actually use a randomized controlled trial crossover design with the currently existing process for teaching these skills with the curriculum that we intend to design. So it will utilize a crossover design as part of the study. In terms of relevance, I think it's fairly obvious what the clinical relevance of the project is. I think in the long term, longitudinally, this has the potential to improve competence and skills that I spoke about, including bag valve mask ventilation and this bimanual compression of the uterus. And both of these skills really can be life-saving for mothers and children at the time of birth. So really, I think longitudinally, the project has some potential to address a major public health issue of high neonatal and maternal mortality rates within the country of the Philippines, and hopefully can be also generalizable to other resource-poor settings. So again, I'd like to thank you for being here today, and I'd be happy to take any questions if time allows. Thanks.